so for the skin tightening for the face, we use the smaller transducer of the UltraSculpt, and we choose the small head by pressing this button and then see the red dot showing that it's chosen. And then we do P0 and level 1, and then deep and Manhattan. Okay, so I'm gonna start by putting the serum oil onto her in the treated areas, probably a couple drops on the top. So I'm gonna basically treat around her scalp and also the ear front and behind. These are the important areas, basically just around her face. Okay, couple more drop here. It's gonna be itchy. Sorry.
No, it's
funny look, feel,
yeah,
huh?
It's ticklish.
Yes. And then I'm gonna put cream on her. So she'll have to wash her hair afterwards, but it's all worth it because she's getting a really good face transforming experience. Okay. And some her chin, the submental area.
So we don't heat
her chin.
We don't heat the cream up because
No.
it changes it chemically.
Right, the microRNA could break if we heat it. Okay, so I'm gonna take this. Okay, and you're gonna hear the ringing sound, which you're used to now. Okay, and then I'm gonna start from the top. So basically, you just want to go around her, not stopping too much in one area, but rather evenly distribute the energy right at the edge of her scalp, her hairline. So believe it or not, even when I do this in front of her ears, she will not feel too much noisy. But when I treat her chin, she'll hear a little bit more, which is okay because I'm on level 1. But for now, I'm going to concentrate on the top half of her face. And I do this about 5 minutes. Then I'll switch to the chin area. And you can see the timer there on the machine. And you just give her like a 5 minutes on the top. And then you switch 5 minutes to the chin. And then you do another 5 minutes in front and behind the ears. And then the rest 5 minutes, you want to look at your client's face and decide where she or he needs the most lift. And you would give them that extra couple minutes in that spot that you think they would benefit the most. Because you have to look carefully of your client's face and chin area and neck area and decide which way is the most effective for them for you to distribute that 15-18 minutes for the whole treatment. And I don't suggest you go too long, not on the first treatment anyways, because 15 minutes should be enough for them to see a very good effect already. And you don't need to really dwell on any part of the face, because when you do this skin tightening for the face is very, very important for a client to be having the even effect. You don't want any part to have uneven. And you want to go behind the ears, because to tighten her chin, behind the ears is where you want to really give that nice treatment. So she'll have very chiseled look, that snatch look of her jaw. And then of course the submental area and the side area. too. But again, you want to move your transducer. You don't want to go on their face that much at all, because on the face they have that nice tissue fat that you want to preserve. And when you tighten the areas, as I show you, fully around the face, you're actually doing a good tightening for them without actually getting on their face. Because on the face, people could have fillers and Botox, all that nice stuff they had recently injected. So you want to be aware of it and make sure that you don't go on their face. And you also ask clients at which location they had Botox, because it's possible that they have some Botox under the chin. Who knows, right? So you want to ask them. And then if they just had Botox injection within like a week or 2 weeks, you want to be fully aware and not give them the treatment until a good 4 to 6 weeks out of the injection.